So welcome to our webinar about hearing health. And this is mostly important. Recently we had an interview with Professor Dr. Skarczynski, and what I realized that hearing health is very important for mental health. And this is true. And let me introduce our speaker, Irina Pizhinska. She will explain what innovative treatment people can get there in Warsaw, close to Warsaw in Poland. So please introduce your medical center, Irina.
Yes, hello, my name is Irina Pizhinska, and I'm representing International Center of Hearing and Speech Medincus. That is, as you correctly mentioned, is located in Poland. This is the way how it looks like. It's a big, pretty big complex, and it is pretty known not only in Poland, but I think in the area of ENT, it is well known in the whole Europe, and we can say even the world. So it is something that are Polish people proud of, and this is today the main topic of our discussion. So why Poland and what about Poland? I remember that I was at the conference even this year, and we were talking about different medical tourism destinations. And I said that Poland is not a very good place for medical tourism. And I was corrected by one of the participants who said that it is not true, and I should be proud that I'm representing Poland. Why? And I decided to mention these main benefits in my presentation also. So while Poland, well, it's a big country, but it's not so well known for medical tourism. But we have the same quality specialists as in Europe. Sometimes there are new approaches, pioneer surgeries, and even not only technological breakthroughs, but also the quality that is very good comparing to other countries in Europe. So Poland is the place where we can find world-class healthcare that you can trust, because it is according to the European and world standards. There are specialists, top specialists also. And what is sometimes important, but not the most important, but it can be like the thing that is the key for some of the patients, is the price. It is something that we can say that comparing to other European countries and hospitals, Poland offers good quality, but for affordable prices. And this is pretty important for the patients from not only neighbor countries, but from patients from different countries of the world. So it is easily accessible location in Europe. There is Warsaw. In Warsaw, there is an airport. In smaller cities, there are also some airports. And we are located very close to the airport that I will tell later on in my presentation. And of course, you can come to Poland not only for treatment, but you can discover here also rich culture and unique travel experiences. So it's, of course, you can visit Warsaw, the capital city of Poland, but there are also very old cities like Krakow, for example, that are very attractive for tourists from different countries. There are also holistic and wellness rehabilitation programs, because around Poland there are some places that are attractive for people looking for rehabilitation programs. And of course, the language, the communication, that Polish people speak different languages. There are English, Russian. There are also nowadays, you can, even if you go to take money from bank, people speak Ukrainian, for example. So there are many cultures, and people from different countries are really welcome, and Polish people are really hospitable. So trying to improve myself and say that Poland is a really good destination for medical tourism. But the main topic, of course, today, as Natalia said in the beginning, it is the hearing. And the International Center of Hearing and Speech Medincus is a leader in the advanced ENT care, providing innovation solutions to patients worldwide. So Medincus, the Center of Hearing and Speech Medincus, was established in 2011, and we were trying, and we are still improving ourselves in providing comprehensive services for patients with the different ENT problems. So our mission, our main idea was to give our patients in one place everything that is needed. So we were trying to not only treat hearing problems, not only do, I don't know, surgeries, for example, but we were trying in one place, under one roof, give our patients rehabilitation, diagnostics, treatment, surgeries, but also there is a hotel, there is some kind of place where they can have rest. So everything in one place. This is our idea, that we were focusing on creating opportunities and fulfilling aspirations in treating hearing loss and supporting our patients in need. So as I said, we are already on the market from the 2011. We were established in 2011, and since then there are many specialists who started working with us, who continue working with us, and our team is getting bigger and bigger every year. So at the moment there are more than 700 specialists working in our network. We perform more than 2,500 surgical procedures annually and do more than 150,000 consultations annually. So it's a very big number for a hospital that is specializing in only one sphere, in only like everything is connected to ENT. And we are proud to say that there were more than 1,500,000 patients already who had used our services and came to Medincus, to the Center of Hearing and Speech Medincus. And when I said network, I was mentioning facilities here in Poland, but also abroad. So at the moment, there are 18 facilities in Poland, 18 clinics in Poland that are all around Poland in different parts of it. And the main hospital is situated in Kajetany, which is next to Warsaw. But also we have, as it is an international network, we have our facilities in different countries. There are 3 clinics in Ukraine, in Odessa, Lutsk, and Kiev, but also there are 2 facilities in Kyrgyzstan, in Osh and Bishkek, 1 in Kazakhstan, in Shymkent, and we have 1 facility in Africa, in Senegal, in the capital of Senegal, Dakar. So at the moment, there are 18 facilities in Poland and 7 facilities abroad. So which show the whole Medincus network. But of course, as I said, like the main idea and my aim today is to present the hospital that is situated in Kajetany, next to capital city, next to Warsaw. So why shall patients, and of course you, choose and recommend us? So what is important is the location. Kajetany is really well known in Poland as a place, as a heart of Polish ENT school. It is a small village, but is very, very well known because of the professionals and because of what we are doing here. We provide world-class service, as I said, according to the European standards. And our patients, as I said, get the most comfortable and personalized conditions of stay during their treatment. As I said, there is everything under one, we can say under one roof. And of course, so it is not the most important, but something to mention, worth mentioning, it is that we try to pay very precise attention to the comfort of our patients, and we provide them not only with the medical services, but also we are trying to give them as the best experience possible, and they have opportunity to use our wellness facilities here in Cayetani and recreational areas that we also have. So as I said in the beginning, we provide diagnostics, treatment, and rehabilitation of ear, nose, throat, and larynx diseases, as well as balance disorders. We are inviting patients of all ages, children, grown-ups, elderly patients, and of course, talking about international patients, there are mostly patients, young children, because it is something that we are specializing at. But also we have also older patients, as Natalia said at the beginning, that the problem of hearing, it also affects mental problems. It is something that is really important nowadays because of that generation, and people around us are getting older and older, and there are more and more people who live very long, and these people, of course, with the age, they have problems that affect their hearing, and because of the hearing, they can have also their mental problems, their problems with just going to the to outside, problem with the environment, problem with communication. It is something that is a really problem nowadays. And as I said, we provide also treatment. And here in Cayetani, in the hospital, we do different ENT surgeries, throat surgeries, hearing surgeries. We provide hearing implant surgeries also, and the whole procedure of cochlear implantation. And also different kind of rehabilitation treatment, and just regular checkups of hearing or ENT tests. The whole team is working on different kind of disorders, audiological, otolaryngological, but also vestibular and balance disorders that I was not talking much about, but it is something that also worth mentioning. And rehabilitation after different problems with the hearing, after the surgeries, voice rehabilitation, speech and language therapies. So Cayetani, as I said, it's a small village, but pretty well known. It is situated near Warsaw. There is a very easy access from the city center from Warsaw, and also a shopping airport. The Warsaw airport is very near. It's about 20 kilometers, and we provide our patients with the whole complex of transfer from the airport to the airport, and what is important, that the hotel for our patient is situated in the same building as the hospital. So patients come here and they're staying in one place, and they get not only the patients but also their families get nice accommodation in a very nice place. And what is important, they do not have to travel from hospital to the hotel. They just go one floor down and they get from the hospital to the hotel. And relatives or family of the patient can be with the patient almost all the time during the treatment. So there are different kind of apartments, of rooms for our patient. They are really spacious. There are different standards of rooms, so we can accept patients from different countries, also even like of different standard of patients and their needs. There is also, as I said, there is a recreational area. There is a swimming pool, which is very nice. Maybe not for the patients, because if they come for the surgery, they should concentrate, of course, on the treatment. But for example, for the family or for rehabilitation or for checkups, they can use this swimming pool area and they can relax there. There is also sauna, jacuzzi, and it's also in a very, very nice, beautiful, peaceful environment with the water without chlorine, which is important, which can be more comfortable for patients and for their regeneration. Of course, we were trying to make our best, and we are extending our offer and recreational area. And now we also offering for our patients some kind of relaxation zone that is complemented by jacuzzi, sauna, and massage. So everything that is needed for the stay of the patients, because sometimes they come for the treatment not only for 1 day or 2 days for checkup, but they are staying for 1 week or even 1 month. And we're trying to make their stay as much comfortable as possible. Also, the area that we are, that Cayetane and the Center of Hearing and Speech situated at, also provides a place for meetings and for conferences. For example, at the moment, we are organizing from today till Saturday, we're organizing a big national Polish conference on ENT, and there are more than 500 people coming to the conference. And this is a good opportunity not only for patients, but for our doctors and our specialists to extend their knowledge, to deepen their knowledge, and for us to share our knowledge with different doctors and specialists from other centers from different countries. For example, next year in May, we're organizing cochlear implant conference, international cochlear implant conference, and we are expecting more than 3,000 people coming to this conference, and we have ability to settle all the people in one place because of the there is not only here the conference rooms, but we also have opportunity to locate all of them here in Cayetane. And thanks to that, we are well known not only in Poland but also in the world, and our knowledge is accepted in the world. So coming back to the patients, not to the professionals, for the families and for the patients, there are also, as I said, recreational area, and they can do different sport activities that are available here in Cayetane, and some kind of complement. It's some restaurant that we have here that is suited for patients for all ages and also for little babies. We are preparing special meals for them, and also for people of different religious or health conditions or diets. We're also able to adapt the cuisine and the meals that we are offering to the patients. So to sum up what we offer, talking about medical tourism and international patients. So before the arrival, we do the preliminary review of medical records and tests. We decide what kind of treatment the patient needs and what we can offer. We help with getting visas. We do the invitations for our patients if they, of course, they need this visa. During the stay, we offer the airport transfer or bus station transfer if it's needed. Accommodation, as I mentioned, in the hotel with the full board here in the one building. There is language and assistance throughout, language support and assistance throughout the stay. There is a whole department, international cooperation department, that helps patients from the beginning to the end of their stay here, and they can if they need some help or they have some problems, they can always ask for this help. So there is also always a person who takes care of the international patient. All diagnostics, treatment, and rehabilitation is in one place, which is really, really comfortable and convenient for the patient. Of course, state-of-the-art clinic and operating theaters, and of course, our experienced doctors, surgeons, and medical staff that we have here in Cayetani in the Center of Hearing and Speech. And after the treatment, as I said, patients sometimes stay for 1 week, or if they come from very far countries, for example, from Kyrgyzstan, they are staying for 1 month for the rehabilitation, for the checkups. So we are sure that the treatment and the surgery went well. And even if they come after the surgery back home, we are still supporting them during the rehabilitation and this recovery period. And we are in touch with the patients after they go home and after they come back. And if they have questions, they can, we are trying, the International Cooperation Department, trying to answer the questions, but if they need, for example, medical support, our doctors are also available via online, so our patients do not have to travel all the time to Poland, to Cayetani, if they have some questions or problems. So talking about this international cooperation, so as I said, we are on the one hand organizing conferences and congresses here in Cayetani in Poland, but also we are participating in different conferences and congresses in different countries to learn more, to extend our knowledge, and to share, of course, experience. We are parts of scientific societies. I will say a few words about that later. And we are cooperating with the different organizations. For example, we provide diplomatic missions. There are lots of, so where patients come to us from. So the first one is the diplomatic missions. For example, we organize hearing screening programs. We were organizing it in different European, Asian, and African countries. And thanks to that, for example, we were going to Senegal, and we organized hearing screening there, and it got such response from the side of the government and local doctors, thanks to which we decided to establish there a clinic in Dakar. So this is something that we are trying to do, to go to different countries, to show our experience, to show our knowledge, to share our knowledge, and to also teach local doctors sometimes, and start cooperation with them. And every time if we go somewhere, of course, we are trying to establish cooperation with the diplomatic missions, diplomatic establishes there in these countries. Of course, there are travel agencies and medical tourism agencies and agents, as some of the participants who are watching this webinar today. We have cooperation agreements, of course, and we are trying to cooperate on individual conditions with the agents and agencies. And we meet with them during different conferences and such webinars, for example, as today. And of course, we cooperate just directly to doctors and clinics in different countries. And if, for example, in case of Ireland, let's say, which is not in the EU, they cannot use some insurance coverage, but there is some kind of agreement with Ireland that patients can pay here in the clinic for the treatment and get the refund in their national health insurance fund. We are trying to use it, and in order to do this, we need to have cooperation with the doctor, with the local doctor, because it is the doctor who sends the patients to send the patient to other country. It confirms that this treatment or this surgery is needed for the patient and can be provided in this country, and cannot be provided, for example, in their home country because of the queues or because of the, I don't know, qualifications. Because, for example, in case of cochlear implantation, single-sided deafness in many countries is not covered by the national insurance, and patients very often have to pay by themselves. So they can choose, they can choose the place where they are going to get this treatment if they are paying by themselves. So again, in this case, we are cooperating with the doctors and the clinics. There are, as I said, it's a network, Medincus, it's a network. So we have our own medical centers in different countries that I mentioned in the beginning of the presentation. And the idea of opening these medical centers, these facilities, was to, of course, to get to the patient, but at the same time, we were trying not only getting the patient, but also giving something for the local doctors. So doctors who work in facilities, in our clinics, in other countries, they come to Poland regularly. They take part in the conferences that we organize, or we send them to the conferences, even locally. We are trying to do our best to extend their knowledge, and they come, I don't know, for workshops here to Poland, for practices. So patients come also from our facilities in other countries. And of course, like I think the biggest number of patients that come, it is the direct referrals. It's so-called word of the mouth. It's like, that's why we are trying to make sure that our patients, when they go home, they are satisfied, because when they come to their country, to their home city, they say that what kind of treatment they got, and they can later on recommend us to their relative friends, and this is the best advertisement that we can get. Satisfied patient, and I think it works pretty well in our case. As I said, we are participating, and we are parts of different scientific societies worldwide. There are different societies: telemedical societies, otorhinolaryngological societies, different international federations. We are also trying to do different to be part of different societies locally here in Poland. For example, we also take part every year in World Hearing Forum and World Hearing Day established by WHO. And we, thanks to that, we were, for example, in 2023, we were honored to get the award and for the best patient-centered initiative that was given to us thanks to our work, and thanks exactly for the work with the international patients. It was the recognition for comprehensive approach of our ENT care, and also for the telemedical care that we provide for our patients with the hearing implants and hearing aids. So to sum up, the International Center of Hearing and Speech Medincus, I can say it's a leader, it's an international leader in ENT healthcare. We are specializing in cochlear implants, in different sophisticated surgical procedures for grown-ups and both children. And we regularly take part in different pioneering usage of telemedical technologies that help us to expand our access to our care for different patients from different groups and countries. So thank you very much. It is the last slide, and here it's some kind of word that I think it's explains our mission and idea that of our center is that the ENT excellence without borders. So we are trying to give the best service for patients worldwide here in Medincus, in the Center of Hearing and Speech Medincus here in Kajetan, Poland. Thank you very much. If you have any questions, yeah.
Yes. About questions wanted to ask, please, colleagues, don't hesitate. You can write in the chat, or you can take your microphone and ask questions yourself. And while people writing something, I will ask you. So a few questions. Do you have some packages, for example, for some diagnostic, or it is necessary to send medical report to you?
You mean packages? Okay. So there are two opportunities. Of course, it is much easier for us, as I said, to make an individual offer. And if we know already what the patient comes to us with, it is much easier to prepare for that. But we can do just the checkup. That is really popular nowadays, and we can see whether like everything is fine with the not only hearing, but for example there are also vestibular disorders that are getting more and more common, and it is something that we can also do as a part of such kind of checkup, as a kind of package of checkup for the patient.
Yes, it's very convenient for agencies to have some like ready prices, not to wait for response from clinic. I understand Medincus works very quickly. Irina,
yes, we're trying to. Yes, we're trying to. Of course, there are packages just for the hearing. If we know already that there is a problem, it's just a regular diagnostic checkup but we divide whether it is for a child or for the grown-up, because not everything can be done, and the tests differ, because for example child cannot do the audiogram when they just push the button if they hear or not, and we need to do the ABR test, which is done during the sleep, and we need to prepare for that, because we need to here we're trying to do it more natural and not to harm. So we're trying to do, for example, ABR test not with the anesthesia, but during just natural sleep of the child. And we are trying to find the time for this test. So we ask parents in advance, what time does your child usually sleep? Is it if it's a small child, if he or she sleeps during the day, or if it's like, I don't know, 3-4 years old, they do not sleep during the day, so what time do they go to sleep usually, so that it is comfortable for the child and we do not push anything. It is something, again, we do the test in the hotel room, so the child just goes to sleep and he even doesn't know that there is some kind of test going on. And patient and the parents are they feel safe, and they do not have to stress that later on they have to take this child during the sleep at night and go somewhere. They do everything in one place, and it's like as comfortable as possible.
Okay, thank you. We have a question in the chat. So Irina, thank you for amazing presentation. She asking about copy of this presentation that you have done. And also, do you provide diagnostic in Ukraine? And there is an option for online consultations before patient's arrival.
Yes, of course. There is, as I said, there are 3 facilities, 3 clinics in Ukraine in different parts, in Odessa, Lutsk, and Kyiv. And there we provide full diagnostics needed for the possible later on treatment, and later on, after the diagnostic that they have in this facility, they can send directly to us and consult to Polish doctors if they have any doubts. And also there is opportunity for the online consultation. Of course, there are 2 opportunities actually. So there can be online consultation just by email. So we just check the result of the test and we say what is needed in this case, or an online consultation with the doctor when the doctor meets the patient and answers all the questions. And again, in order to do this consultation to go as smooth as possible, we ask to send before some tests, the diagnostics, so that we do not meet and say, okay, we need this and this, and patient says, I don't have this kind of test. And in this case, the like this online consultation, it just doesn't have any sense. So that's why this international cooperation department is needed. And in order to do this work of the doctors and the patient, this cooperation of the doctor and patient smooth. Yeah, so there is opportunity, as I said, and I don't know, agents can write directly to the International Cooperation Department, to me or to my colleagues, or they can go or write, call to our Ukrainian facilities, and we are in touch with them. So both ways are possible.
Okay, thank you. Next question is tinnitus and ringing in the ears after COVID. Is it worth to travel to Poland for this problem?
Oh, it's a very complicated question. And we had this kind of patients, unfortunately, more and more. And it depends, like, what was the main cause of this tinnitus. And unfortunately, if it was COVID, there is not much to do. Of course, we can do the medical support of the patient to make their blood flow go smoother and faster, so it wouldn't affect this, it wouldn't cause this tinnitus and this ringing in the ear. But unfortunately, there is not much to do with this problem, and this is a problem that affected lots of people after COVID, and we offer just some kind of rehabilitation after it and support of medicines. It is so, unfortunately, surgically there is not much to offer, not only in Kaitani but in the world.
Yeah, thank you for this. Next question. Are there technologies for restoring nerve conduction disorders, or is implant is only solution for that?
You mean probably sensorineural hearing loss?
Like they send these questions. I just
It depends on the condition. If it is not severe, so there are hearing aids. If it is severe, there is a cochlear implant. There are some at the moment. There are some studies to restore these hearing cells, but it's just the study, and they are not. It doesn't give so much effect and prognosis for the nearest future that it would be possible for the patient. Also, there was a surgery that was provided here in Poland, the pioneer surgery, when the cochlear implant was in one part. So usually the cochlear implant consists of 2 parts. There is part that is put to the cochlea, to the inner ear, the implant, and there is a speech processor there is outside that looks pretty similar to the hearing aid. And they are connected, so speech processor gathers the sounds and transforms it to the through the electrical impulse to the implant and then to the brain. And we had this first surgery that the implant was in one piece, so there was nothing outside, and the implant was put in just the inner ear to the cochlea. And after this surgery, there were many patients from different parts of the world that were asking if they can use this breakthrough technology. But again, unfortunately, at the moment, there are just studies, and we're trying to see what are the effects, what are the bad sides of this, but what are the good sides. But I'm sure that as soon as it is available in the world for the patients, we will be the first to offer this kind of solution for our patients.
Fantastic. Sounds fantastic.
Yeah, we're trying to progress, but it takes time. I hope that it will be in our memory, in our history, that we have this kind of surgery possible for the patients.
And thanks God, medical tourism in Poland, it is affordable prices, and many people can have this treatment for good prices.
Yeah.
Thank you, Irina. Thank you, everyone, for coming. So after this webinar, you will get recording, you will get direct contact of Irina, and you will communicate and talk about cooperation. Thank you.
Thank you very much. Thank you.